58-year-old gentleman who presents with paroxysmal atrial fibrillation, who was found to have a small secundum atrial septal defect and considered to have some right ventricular volume overload that we'll probably question and debate now, but Antigone will take us through the anatomy.
So it's a single defect in the anterior aspect of the atrial septum, maximum dimension 11, it's 11 by 7 millimeters. Very small aortic rim, but adequate rims all around otherwise. We've looked carefully for any other shunts and we couldn't see anything else. And that's the biggest dimension in the infrasuperior dimension. And that's the defect here. You see it again in the anterior aspect of the septum, and then view from the right atrial side.
Fantastic, thank you. We're bringing up a 24 millimeter AGA sizing balloon over an amplat superstiff position through the defect into the left upper pulmonary vein. So sizing balloons coming into position there. And then to stop flow. Need a little bit more in the balloon there. Is flow stopped there? Yeah. Store that, Freddie. So probably getting fairly similar dimensions to your earlier measurements. So 8 and 10 millimeters. So obviously the lower limit for a Gore cardioform ASD occluder is 8 millimeters, and we could easily put a Gore cardioform septal occluder into this defect. But for the sake of teaching purposes, and I'm comfortable putting in the ASD occluder, and so I'm going to take a 27 millimeter device. So we're going to load the monorail catheter onto the amplat superstiff wire. And then flush as we go through the 11 French Trumeau sheath, which this 27 millimeter device will go through, and try to keep the wire and the catheter parallel. And you shouldn't meet any resistance, it goes very easily. And then bring the device up into the heart, across into the left atrium. Antigone, we're in the left atrium now, and I'll remove the super stiff wire. So probably in the left upper pulmonary vein with the device there, and we'll need to come back. So it's important that you give your imager time to find where the tip of the device is. So I'm coming back now, just till we're free in the left atrium, which you can see nicely on TOE there. And I'm going to slowly bring the device up to the radiopaque marker. Again, there's no hurry here. And now we're ready to unsheath the device in the left atrium. So I don't want the tip of the device to extend any further into the left atrium than where I am now. So by advancing and unsheathing at the same time, so advancing the device and unsheathing the delivery catheter, keeping an eye on the TOE. You can do this as slow as you need to. If needs be, I can tip the device away from me to create more room in the atrium. If you do that, just let the imager catch up, because they will have to alter their position. So there, we're fully advanced now. This device advances around about 25 millimeters forward into the left atrium. And we've hit the hard cue of the device, hard stop, sorry. And so now we're going to bring out the left atrial disc, which you can see coming out there. And then you'll come to a soft cue, and it is quite soft and easy to miss. There the left disc is fully out, so it looks like an ice cream cone, and we can bring that down into the defect now. You can offset the angle a little by tipping the device away from you, and it's okay to deploy it upside down if necessary. So a fair amount of tension, and you can see that there's a lot of cupping on the left disc, which I can show you there on acquisition. So I'm going to now bring out the right disc and the waist. So the waist obviously first. And slowly so that your imager can keep up with you. And there's the right disc out now. And then just relax. Store fluoro. So there's still quite a lot of angulation on the device, but hopefully you're able to see.
It's already in a very good position. Starting all checks from the beginning. No residual shunt that we can see. We've seen during deployment the discs nicely on each side of the septum. Here again you can see the septum in between the discs.
So if we do a stability check now, so on fluoro I can see that the discs are separated, and if I push forward, the right disc cups, which you can just see there, and if I pull back, the left disc cups, which you can see there. So again, pushing forward, you can see the right disc cupping, and pulling back there, the left disc cups. So the stability check on echo and on fluoro, I'm pleased with. Are we good to lock?
Yes, absolutely.
So we'll lock the device, making sure we're neutral on the septum. Firm hand on the back of the delivery mechanism. Red in the clear. Swift movement back. And the device now moves into a neutral position. And then again, we'll just allow time for Antigone to check that she's comfortable.
So now tension's gone, so the position slightly changed, but you see it nicely covering the defect.
Freddie, can you go eleocranial for me?
Nice position, hugging the aortic rims we saw earlier, and now the SVC rim, no shunt.
Freddie, do you want a cone in there?
Here's our device on the LA side.
So this device, the 27mm, has 6 wires, 6 petals, and we saw all 6 on the left side there. It is harder to see the right disc, but we've seen that well during deployment. In LAO, we can see nicely on this zoomed in image that the discs are separated inferiorly and superiorly. We can also see, if I acquire a shot, the locking loop as well as the central wire connecting the left and the right eyelet are all in the position that I'd expect them to be in. So I'm happy to release the device. Antigone, are you happy?
Yes, I'm happy.
So on fluoro and on echo, the retrieval lock is brought back, twisted to come off. Make sure that the other end is still free. And then keeping an eye on the device to make sure nothing changes. The retrieval cord is removed. And the catheter is now free from the device. And we're able to bring it down out of the heart and do further theory assessment.
The maximum dimension we have, no additional defects. It's by cable view, and then view from the left atrium. You see the defect here, as we said, anterior superior part of the septum, and then view from the right atrium with SVC and IVC, and that's the
So as I advance forward with the device, I'm bringing the catheter back so that the tip doesn't need to move any further forward into the left atrium. And simultaneously you can see on echo, free wall of the LA, and I don't want the tip to advance at all any further forward. I don't really mind if the device is coming back into the ASD at this point. I know I'm fully advanced and ready for the left disc to come out. So advancing again now brings the left disc out, but the device won't advance any further forward. Now if I need to move further into the left atrium at this point, I'm not anxious about doing so. I will just advance a tiny bit, and then I've got the left disc fully out there. And I can see both of the superior and the inferior portions of the disc to be in the left atrium. You can see there on that 60-degree TOE view the aorta, the aortic rim, and we can see the superior rim of the defect. So we're now in a position to come back onto the defect, which you can see on TOE. And we want to see the device to start to cup. I am going to turn it a little to try to get it to sit into the defect so that I can bring the right disc onto the right side. Freddie, if you go a little LAO here, we'll probably be able to see the device a little easier with the TOE office. So you can see that there's a lot of tension on the left disc at this point. So I can then bring out the waist and the right disc, and then just relax into a neutral position and let Antigone explore how the device is sat.
From the beginning, we'll follow the device through the different views. There's no residual shunt. It's sitting beautifully on to 45 and 60 degrees. Almost 90, the bicaval view. So no residual shunt, and we can see clearly the discs on each side of the septum again, and then the final check with 3D image to make sure that each disc is on its side. View from the left atrium, we see the left disc nicely there.
So this disc has 6 wires, so we're looking for 6 petals, which we can see there very well on TOE. So I'm confident that the left disc is fully deployed on the left side with all of the 6 petals.
And then that's the disc on the right atrial side.
So Freddie, if you could do a shot eleocranial for me. We'll just check on fluoro that the device also looks well separated. And could you come RAO caudal, which will give us an on-pass view.
Just careful with the drip, please.
Okay, and back eleocranial. And then Freddie, if you could cone in, we'll just have a look at the locking loop to check that that's fully deployed.
Yes, do more high.
Yep.
Yeah, good.
So you can see the left eyelet here, central core of wire running through the right eyelet here, and the locking loop here.
We always finish when they 0 degrees. We check for any pleural effusion at the end, and there's none. That's it. Very good.
This patient is 58 years of age and presents with exertional dyspnea and was found to have a moderate to large secundomatrial septal defect and is here for closure. Dr. Deri, would you take us through the TOE images?
Yeah, we've got a single large ASD within the awful fossa. We start from 0 degrees. And measurements start from about 16. The dimensions are approximately 19 by 16 millimeters. Adequate margins, as you see, good aortic margin. And then as we move on to the bicaval view, you see that the tissue is slightly thinner on the inferior rim, but not aneurysmal. That's eustachian valve there. And then view from the left atrium, almost round in shape, and view from the right atrium.
Okay, so we'll just bring a 34 millimeter AGA sizing balloon into position over this amplat super stiff. I put a 14 French sheath in the groin, which will accommodate the likely device choice that we're going to make. And the wire is positioned in the left upper pulmonary vein. So Antigone, I'm just putting the balloon up now for stop flow. See nicely on TOE, there's still a little bit of flow there. How's that there? Still fluoro? So we're getting about 18 millimeters and similar waste on the balloon around 18 millimeters. So I think with confidence we've sized the defect at 18 millimeters and we'll take a 37 millimeter Gore cardioform ASD occluder. So amplat super stiff on the monorail system. You can see that there's a small hole for the wire to come through. That's great. And then Adele, if you can flush as we go through the sheath. And then I'll try and keep the catheter and the wire parallel and make sure it runs cleanly through the sheath. Okay, and then we'll fluoro into position. Okay, nicely in the left atrium. Can remove the super stiff wire. And then make sure we give plenty of time for the imager to catch up. So Antigone, we're probably in the left upper pulmonary vein there.
You are indeed.
So I'm coming back into the left atrium. There's plenty of space in an adult heart such as this. That should be in the LA now. So still need to come back a little more.
That's a better
there.
position.
And so now I want to bring the device to the tip of the opaque marker on the delivery catheter, which is actually just a small movement and not very much distance. It's there. And then I want to unsheath the device in position. So the goal here is to not allow the device to move forward any further into the left atrium. So as I advance forward, I'm actually bringing the delivery catheter off the device. And Antigone will tell me, I can't see the TOE, but she'll tell me if I'm advancing forward. And we're ready now to bring the left disc out. So push forward. The left disc is now coming out. You can see it there in the left atrium. Okay, so now we're coming back onto the septum. Again, a fairly slow procedure. I'm going to turn the device away from me to see if I can orientate it a little better without it prolapsing, looking for the left disc to start to cup before bringing out the right disc. So there you can see it cupping, bringing out the waist and the right disc. There, and then relax, take the tension off. So Antigone, do you want to have a look and see how that device is seated?
Yes.
So it's obviously still quite angulated to the septum because of the attachment to the delivery catheter.
There is indeed quite lots of tension still with angulation.
So our goal here is to show left disc on left side, right disc on right side, no residual defect, as well as symmetry of the two discs. Freddie, would you go into an LAO projection for me? So you can see there on fluoro, we've got good separation and no clustering on either of the petals. Could you show that fluoro, please, Freddie? Antigone?
I do have a shunt there, but I think it's because of the tension and the way the discs are sitting with each other. You can see the discs on each side of the septum.
Yeah, I think that I agree. I think that there is a small shunt, which is not surprising, and we'd often see that. But I think that that will go when the device
you see how it
orientates
sits
into
on the left atrium. It's in an angle rather
Yeah.
than parallel as you would want it to be.
Okay, so I'll lock the device. Pleased with its appearances. So fairly firm hand on the back. Then we've got the locking mechanism here, the red and the clear. Screen as we do it. There, we're locked now.
That's much better position, so let's look at it again now.
So there we can see the central wire connecting the left and the right eyelet, as well as the locking loop on the right side.
We have a dilated right heart, suggestive of a large left-right shunt. And as it comes into view, you'll see it's a large defect, maximum dimension in AP orientation about 22 millimeters, you see here. And then we'll go through the different views. It's oval shaped, so smaller in the other dimensions. Has adequate brims all around. You see the aortic rim here is quite good. And the only thing I would say is that the inferior rim is slightly thin and floppy. So you're gonna see there you see the inferior rim here being a little thin and floppy, as we said. And that's the X-plane of this that measures again nearly 22 by 15, and that's the view from the left atrial side. You see that thin tissue inferiorly, and view from the right atrium. And that's the wire crossing the defect. Okay, so we'll balloon size now. This is a 34 millimeter AGA sizing balloon on a 035 Amplat super stiff in the left upper pulmonary vein. Go for stop flow, something like that. I have a little bit of flow still. You still got a little bit of flow. Hang on a second, let me take the balloon down.
Stop flow there, or?
No, I
No.
still have quite a lot of flow.
Okay, a little more.
I think we are okay here.
Okay, so oval-shaped defect. Some inadequacy of the septum inferiorly. So the device choice here is a little more difficult as to whether to go with the 37 or the 44. So I think given the sizes that we're getting, I'd like to try the 37. What do you think, Antigone?
I think so.
Rather than going with the larger device. Feed that off for me.
Yeah, I agree.
And then we'll see how that sits, and then, you know, if we're not happy with it, we could retrieve it. And so I can see the waist on the fluoro was 21.6. So we'll take the 37. Debbie, do you agree?
Yeah.
Yeah? And then we'll see how we feel. So monorail system. And then we'll flush as we go through the sheath. So I've got a 14 French cook sheath in the groin here. Keep everything parallel. Are you able to flush for me? That's great. And it should go easily through the sheath, no resistance. Up over the wire into the left atrium. Remove the super stiff. So Antigone, we're fairly deep in the left atrium there.
Yes, you are.
Allow plenty of time for Antigone to catch up. I'm just going to bring the delivery system back now till we're free in the LA. There, so come back a little more.
Yes, that's
Okay,
that looks
good.
like a good position. Yeah.
So we can see the tip of the catheter. So now I'm going to bring the device to the end of the catheter quite slowly. Okay, and now I'm going to unsheath the device into position. So advance the device and bring the catheter back at the same time. I don't want the tip of the device to go any further into the left atrium. And again, it can be done very slowly. Give plenty of time for your imager to keep up. If you need more room in the left atrium, you can tip the device away from you. And I've come to the hard stop. So the left disc will now come out. So the device won't advance anymore. You can see the disc coming out now in the left atrium. And then we come to the tactile cue. So I know that the left disc is now out. I can come back with the whole of the device onto the septum. So you can see it well. Again, there's no hurry. And then you just see the left disc, the petals of the left disc start to cup, which we're just seeing there. Okay, and then I'm going to start to bring the right disc out. So we've got the waist here and the right disc coming now. Take the tension off. And just relax, and then give the imager time to have a look through and see what we think of that position.
Okay, let's start from the beginning again. We'll put the color on. I do have a significant shunt. I'm not really sure about your superior, the superior part there. I think you do have prolapse through.
Yeah, so this is a brilliant example of how we've got a large residual defect and we've got prolapse of the aortic rim of the left disc into the right atrium, which you can see well there. So this is not adequate, and it's one of the concerns really, and it's possible we'll need to upsize, but I'm going to try to reposition the device first. Before I do that, it's worth just looking at the fluoro here, because you can see that the separation of the discs is not correct, and you can see that the wire is also bunching up. Would you take an LEO shot of that for me? Antigoni's also showing you on 3D that the left disc is prolapsed. You can't see the petals completely. And there you can see there's not separation there of the superior disc there. There is of the inferior portion of the disc. And back to PA. So I'm going to retrieve the right disc, and then we'll reposition the device and see if we can deliver it with a little less tension.
You're still on the other side.
That's good. So I need to take it into the left atrium.
That's great.
Make sure the left disc is fully deployed, which it is now. I can feel the soft tactile cue. I'm coming down onto the left with the left disc there. I'm going to just turn the device upside down here to see if I can get it to sit a little better. And now I'm going to deploy with a little less tension to see if I can stop that left disc from prolapsing. Like that, and relax. And then let's look at that and see if we've achieved a better result.
Much better now. You see on the superior end nicely the disc on the left side.
So it seems like the residual defect is not covered there now, so I'm pleased with that. Yeah, we appear to have the left disc there of the aortic, covering the aortic rim of the defect. Well, we'll just take our time to assess this. I'll show you while Antigoni's having a look what the device now looks like on fluoro so that we can compare it with the previous image. But you can see now that there's good separation superior and inferiorly. Obviously the device is still quite angulated on the delivery catheter, but once we lock that, it will sit in a more natural position.
So that's much different to previously. You see the whole disc here on the LA side. RA side is always a bit more tricky, but I think I'm happier with how the device is now sitting. So I think we can
lock it, and then we'll have a look again. So I'm going to lock the device. So again, firm hand. Make sure we're neutral. Still fluoro.
Nicely positioned now that the tension is gone. And we've lost that little shunt we were seeing earlier between the discs. Again, we can see nicely the tissue in between, grasping that superior end beautifully.
Oh, that's fantastic. That's a very nice image.
And then nicely sitting there.
You can see all 6 petals there on the left side.
Should I get a quick shot of?
So we'll just take, can you go a little more LEO, Freddie, and see if we can show the separation of the discs. There we go. So we can see here separation of the discs inferiorly and superiorly. We can see the locking loop now in position with the central wire between the left and the right eyelet. And I'm happy that there's not bunching of either the right disc or the left disc. So on fluoro and on TOE, I think that we're happy to release the device. Antigoni?
Yes.
Come back to PA for me. So unclip, twist, keep an eye on the TOE as we release the device. So a little bit of tension, so I'm just doing it slowly as it comes through. And there, it's come off quite comfortably, and then you can remove the catheter from the heart. And we're finished.